primary care cards as a tool to enhance resident learning in the outpatient setting. Hi, I'm Dr. Rosemary Bird. I'm a PGY2 at Harbor UCLA, and I will be presenting with the Harbor UCLA Community Health Fellow, Dr. Gina Guillaume. Dr. Sarah Nazarkhan is the principal investigator and our advisor, and Dr. Diana Garcia and Dr. Saba Malik are PGY3s at Harbor UCLA Family Medicine Department. They have all been instrumental in developing this project. We have no disclosures. I'm excited to introduce our scholarly project for the STFM Annual Spring Conference. Medical objectives and milestones of resident education are set by the Accreditation Council for Graduate Medical Education, also known as ACGME. They establish medical objectives and knowledge requirements that are constantly evolving. As resident educational requirements evolve, medical educators are constantly evaluating techniques that can best disseminate medical knowledge and improve learning. While some studies have looked at innovative medical training techniques in the inpatient setting, few have analyzed the educational impact of various teaching tools in the outpatient arena, and whether these tools cater to the varied learning styles of medical residents. In summary, how do residents learn? And number 2, what are some barriers to the learning styles of residents in their training? And number 3, are the techniques that we are currently using, particularly in the outpatient setting, tailored to the learning requirements of our residents? Therefore, the aim of our study wanted to address that directly. Our aim was to determine how the implementation of monthly primary care cards will affect residents' self-perceived competence and confidence in the evidence-based management of common chronic diseases in the primary care setting, as well as obtain information regarding residents' preferred learning styles and barriers to learning. Now I'll review the methods for our scholarly project. First, we gauged interest in our family medicine residency program. We wanted to seek residents who would be interested in developing and organizing this project, so we sent out an interest email in October of 2020 to the family medicine residents and faculty. With responses from 3 residents, 1 fellow, and a faculty advisor, we met to pre-select 5 out of the 10 common chronic conditions that we treat in the outpatient setting that we deemed were high-yield topics for family medicine residents. We also then submitted the IRB project, which was approved. As a group, we divided amongst ourselves the creation of monthly laminated cards with these 5 common chronic conditions: diabetes, COPD, hypertension, chronic kidney disease, and congestive heart failure. These cards were distributed among 32 residents of our family medicine department, excluding the co-investigators, on a monthly basis in a centralized location in our clinic. For us, it was the precepting room. To assess for the change in residents' self-perceived competence and confidence of common chronic conditions, along with their self-reported learning styles, we disseminated a pre-test survey prior to the cards being handed out in November of 2020. Then we followed up with a post-test survey in March of 2021 after the last primary care card was released. Our cohort of 3 residents, 1 fellow, and our faculty advisor met monthly to assess the project framework, check in with one another, and prepare our data.
Thank you so much, Dr. Bird, for going through that introduction and our methods. So as stated, my name is Gina Guillaume. I'm the current Community Health Fellow in the Department of Family Medicine at Harbor UCLA. And I would like to discuss the sample of our primary care card that was released. Here you can see our sample of the diabetes mellitus card. So each card was double-sided and had a hole punched that could be carried around as a badge for educational use. This shows the front of the card. As you can see, we reviewed the subtle differences between the American Diabetic Association, ADA, and U.S. Preventative Services Task Force, USPSTF, diabetes screening guidelines. For instance, in yellow, we reviewed the ADA recommendations screening for all adults with BMI above 25, 23 for Asian Americans, along with certain risk factors such as diabetes among first-degree relatives, hypertension, and the other risk factors listed here. Whereas the USPSTF, here in orange, recommended screening in adults aged 40 to 70 years who are overweight or obese. The front of this card also reviewed follow-up criteria for abnormal plasma glucose levels in magenta and A1C levels with appropriate interval testing and appropriate diagnosis of diabetes, such as confirming of 2 consecutive fasting plasma glucose levels greater than or equal to 126 or 2 consecutive A1Cs greater than or equal to 6.5% versus just a single value. At the bottom of this card, here in light blue, we also discussed the initial management of diabetes and impaired glucose recommendations set by the American Diabetic Association. Here is the back of the card, which details in green the goals of our fasting blood sugars, and also in yellow our A1C level goals for diabetic patients that are also set by the ADA. Additionally, we listed the first-line therapy for diabetes in magenta, which is metformin, along with GFR considerations when starting or stopping metformin, monitoring metformin usage, and its side effects. Last but not least, this card listed in blue the common therapies for diabetes in this table, from insulin, sulfonylureas, GLP-1 receptor agonists, etc., along with their advantages and disadvantages. So in summary, we modeled this content for the other cards as well. As Dr. Bird stated, we composed a laminated primary care card for each topic for diabetes, COPD, chronic kidney disease, hypertension, and congestive heart failure that was distributed to residents on a monthly basis. This slide provides specific content that we placed in each card to assist with resident learning, including, but not limited to, diagnosis, evaluation, first-line treatment, complications, and when to refer for each of the 5 topics. Now I would like to discuss some preliminary results from our study. This slide reviews the demographics of our pre-test survey. We aim to have a participation rate from greater than or equal to 80% of all potential subjects. Our preliminary pre-test demographics showed that 75% of residents participated in this study, composing mostly of our PGY1 interns, which is a number of 10, an equal number of PGY2 and PGY3 residents, which is a number of 7. This study is still in progress, and we are still collecting post-test surveys from our residents. We hypothesize that residents will report an increase in self-perceived competence and confidence in the evidence-based management of common chronic diseases in the primary care setting gained using the primary care index cards. We also anticipate obtaining valuable information regarding their self-identified learning styles and barriers to learning, which will help to tailor and develop future teaching modalities to best serve their needs. So stay tuned and look out for the most updated information of our primary care cards as a tool to enhance resident learning in the outpatient setting at our SDFM poster presentation at the 2021 SCFM Annual Spring Conference. Here are our references, and thank you so much for listening.